Welcome to Psyched Up. Psyched Up, where each new show will feature expert guests tackling the most pertinent problems in the field of mental health, is brought to you by the Suffolk County Psychological Association. Now, here's your host for today's show.
Hello, this is Dr. Howard Gurr. I'm the host of Suffolk County Psychological Association's videocast, Psyched Up. And today we're going to talk about senior citizens and therapy with our guest, Dr. Joanna Negro. Joanna Negro has been in practice in Huntington for 10 years. She earned a doctorate degree from Yeshiva University. Dr. Negro works with a wide range of people from ages 3 to 100. She's worked in nursing homes for years and is very familiar with the issues of aging. Welcome to Suffolk County Psychological Association's podcast, Dr. Negro.
Thank you very much for having me, Howie.
You're welcome, and thank you for taking the time and being with us. So I guess the first question would be, what would be the primary reasons senior citizens would be seeking therapy?
Well, many people come for the same reasons anyone would come to therapy. Anxiety, depression. Some people come with lifelong mental health issues. And then, of course, there are concerns that are particular to older people. Generally, they have to do with loss of one sort or another, whether it's loss of a loved one, a spouse, or someone else, whether it's losses associated with health. Sometimes as people's health declines, their functioning declines, and that can have effects on many aspects of their lives, including their mental health.
Are there specific barriers or issues that prevent these people from getting the help they need?
Well, those generally fall into two areas. Sometimes there are really just practical constraints. People sometimes have mobility issues, they're having trouble getting around, or sometimes there might be transportation difficulties if the person's no longer driving and they need to rely on somebody else to get them places. And then sometimes there are barriers that have to do with people's attitudes. You know, there are big generational differences in the ways that people think about therapy, and sometimes for older people, the idea of seeking therapy is more difficult to accept because they feel like it's it's a sign of weakness. It's not something that they should be doing, want to be doing. So sometimes a lot of times an older person will come at the impetus of a younger person in their life.
Okay. Does therapy actually differ with senior citizens than it does with other populations?
I would say overall it's probably pretty similar. There are some ways in which working with older people actually can be easier. Many times older people have a lot of a very high degree of self-knowledge. They kind of know who they are. They're very quick to understand what they're bringing to any situation, and that self-knowledge can really expedite the process. It can really make therapy go faster. And also, a lot of times, once the person gets into the room, they're ready to change. If somebody's coming to therapy, after 6, 7, 8 decades of dealing with something in their lives, and then they sit down in your room, that's a person that's usually highly motivated. They're ready to go. I've had people sit down in my room and say, I've been dragging X around with me my whole life, and I'm done. Let's finish with that. And that's generally going to be someone who's going to make a lot of progress and do really well.
For somebody who's hesitating to seek therapy, what would you like to say to them?
I would say that mental health challenges and mental illness are just that. It's an illness. And you would never try to tough it through your diabetes or your cancer or anything else you might be dealing with medically on your own. And there's absolutely no reason to do that with a mental health issue. It's treatment works. You can feel better, and it can really impact every aspect of your life. You know, if you're not going out because of anxiety or because of changes in your body that have made you self-conscious, those are all things that therapy can help with, and it really can give you back pieces of your life that you may think you've lost forever.
So you've been practicing in Huntington, and I guess, is there a way that people could contact you if they would want to seek your services?
I would say the easiest way to get in touch with me is to just pick up the phone. My practice number is area code 631-796-4784. And of course, the Suffolk County Psychological Association website, which I always recommend to everyone, which is suffolkpsych.org, and the wonderful Find a Psychologist feature. You, on the homepage, left-hand side, click on that button, and you can find a wealth of wonderful practitioners in Suffolk County, including myself.
Thank you. It's great. I appreciate the plug for Suffolk County Psychological Association. So, Dr. Negro, thank you for your time, and I hope that our guests and listeners and people who watch these videos gain some information about how to access and the need for senior citizens to get the appropriate help. So,
thank you so much, Howie.
Thank you. So until next time, this is Dr. Howard Gurr for Suffolk County Psychological Association's videocast, Psyched Up.
SCPA's mission is to promote the profession of psychology in Suffolk County through fellowship, education, and advocacy. Our website has a searchable database to help you find a psychologist near you. For more information about SCPA, go to suffolkpsych.org. That's SUFFOLKPSYCH.org.